Okay, we're going to take a few minutes and go through a few cases. I think it's fun sometimes to step back. We go through the x-ray analysis. We learn how to get the listings. We learn how to do our pattern analysis. We learn how to adjust, when not to adjust, and we learn how to adjust. We understand the neurology. We go through the basic KCUCS program, and I think it's a great program, but I think it's really awesome to step back sometimes and just kind of look at the fruit of our labor, if you will, kind of get an idea of, okay, this all sounds good, but what happens once you apply it? So I wanted to pull out a few cases here, and I have to say that these are not extraordinary cases. They're just cases that I thought were interesting because they were documented, and I thought that we'd like to share them. The first case was I believe she was an 18-year-old girl, maybe had been 20. No, I think she was an 18-year-old girl, and she came in with low back pain. And so through the course of going through her case, we looked at it and we determined, of course, that we needed to get her head on straight. We found what we see right here. The neutral lateral was performed prior to KCUCS upper cervical care, 7/11/2011, and of course the interest complaint was low back pain. She'd been having low back pain for a long time. This was not something that just came about. This was something that was more chronic in nature, which is kind of funny for an 18-year-old, but she had been having it for the last few years. As a matter of fact, this report or this study was written up, and we possibly will get this published. It has already been written up. It just needs to be tweaked to be able to do it. It's just a matter of it sticking on the desk needs to be done. So anyway, this is the first film. And then on the first visit, before we actually got started with her, we went through and did an HRV. So the HRV, heart rate variability, this is an instrument that we use to measure the autonomic nervous system. We want to see a couple of things. There's a number of things we can see from this, but two things we primarily look at is this autonomic activity index, autonomic nervous system activity index. It's a pretty good broad measure of how healthy the autonomic nervous system is. And then, of course, we want to see the balance. We want to see if the parasympathetics and the sympathetics are balanced. The ideal position for this dot would be right on smack dab on top of that 9, if I could say it that way. Anytime you get outside of that, then we're moving into a place of an unbalanced or imbalanced autonomic nervous system. So that's how she presented right before the adjustment. This is the second neutral lateral that was performed 4 weeks following the initiation of KCUCS upper cervical care, August 8th, 2011. Low back improved significantly, but not completely resolved. So this is kind of unusual. If this is a simple case, low back pain, usually you all adjust them, the back pain's gone, everything's fine. Of course, we're not just adjusting for symptoms, but the fact is you get the upper cervical right, and you get it balanced, and you establish a normal center of gravity. These things just straighten up generally, unless you've got a little bit more going on. And that's one of the reasons why I shared this case, is because she did have some imbalance going on in the autonomic nervous system. So it wasn't just strictly a mechanical problem, although that definitely was a portion of it. Our second HRV actually looked like that, and you can see on the one side the activity index actually dipped just a little bit, but we started moving into more of a balance, and I thought that was a kind of a neat thing to show, because we can see that actually through the process of getting well and restoring health after somebody's getting clear, the body's going to go through changes, and sometimes when you look at it and you take a snapshot in time, it's going to look a certain way. Like for instance, if you adjust somebody today, they may come back in 3 days and say, oh my goodness, after I felt great for 3 days, and now all of a sudden my hip hurts. And then you ask them, well, were you having hip pain before? No, I wasn't having it, but I used to have it like 10 years ago. Well, there you go. They're going through a normal process of retracing, but if you took it at one slice of time, you would get incorrect information. You'd think, oh my goodness, what I did was did something detrimental, or we're going the wrong way, or we need to do something different. But you need to understand, or we need to understand, I put myself in that category, I'm pointing fingers at myself, we really need to understand the physiology and how the patient's walking through situations so that we can better coach them and stand firm on that rock and understanding when the line is clear that the patient is healing, and that's really our goal, is for the patient to be clear so that they can heal. Okay, so that's the second one. This was our third neutral lateral, performed 3 months post the initiation of KCUCS upper cervical care, October 24th, 2011. All symptoms completely resolved. I thought this was a pretty awesome post picture. And here's our 3-month, our autonomic nervous system activities back about where it was, but the good thing about it, now we're looking at a balanced sympathetic nervous system and parasympathetic nervous system, autonomic nervous system, which is your parasympathetics and your sympathetics. You remember we talk about in the seminars how when somebody's sympathetic dominant, it can really be the first stage of setting things up like messing up the HPA axis, the adrenal fatigue, and a whole host of things that can even run the gamut of thyroid problems, insulin problems, all kinds of hormonal issues. There's a lot of issues that can go on when the autonomic nervous system gets imbalanced. And let me just say this, when we're dealing with upper cervical, I really believe there's 2 major factors that we're really dealing with. Number one is there's just a pretty straightforward center of gravity issue. When that head's not sitting in the groove properly, it shifts the center of gravity in such a way that the vestibular apparatus within the brainstem is going to make necessary changes in the posture, changes in the hip, short leg, changes in the shoulder heights, changes in different areas of the body to compensate for that wrong position. So therefore, when we put the head right back in the normal position, now we start going into a balance, and sometimes these compensations begin to unwrap and unravel as they work back into normal. That's the reason why, from a mechanical standpoint, we will have retracing and we will have a visitation of old symptoms. I remember I had a patient one time that came in and had all kinds of problems that weren't, it's kind of funny because we really, in our clinic, we attract, I showed a low back pain patient here, but we attract really very few like back pain, low back pain patients, even neck pain. You'd think we'd get more than we do. We seem to attract the autoimmune, thyroids, the adrenals, and a lot of skin stuff and a lot of stuff like that, which is pretty cool. I like to see those things, those people respond to that. It's really awesome. But anyway, this guy comes in, and I can't remember what his condition was. I know he had a seizure and some other stuff. But anyway, we had adjusted him. And right after the adjustment, he walked out. Actually, he rested, rested for his time to rest. And then he went out to his car, and he started feeling his pain on his foot. And then he went home, and he didn't think anything about it. And then 2 or 3 days later, that pain got not real intense, but it was enough that it was bothering him. And then over the course of the week, the pain went away. Well, it was very interesting. He comes in the next week. I had been seeing him for maybe 6 to 8 weeks, maybe 10 weeks. I don't remember. But it had been a course of time where I was now checking him once a week. So he comes in, and he said, "Hey, Doc, after the adjustment, I said, my foot really started hurting really bad." And I'm telling you the story because this is one of the weirdest retracing stories that I've heard. I said, "Have you ever had that pain before?" Because the line was clearing, and he was straight, and it looked good, and all the other factors were doing so much better. I really felt like he was on the right track. So anyway, he said, "Yeah, I did, as a matter of fact." He's about 48 years old. He said, "When I was 17 years old," this guy's a big, burly guy. He said, "I was helping somebody," and mainly he was doing it, "pick up a 350 Chevy engine, engine block, and I dropped it on my foot right exactly where that pain was. And I had that exact same pain for a long time, and it finally just went away." So I thought that was really weird because we adjusted him, and he was working through the process of retracing and restoring his health, and he actually retraced an engine block falling on his ankle. So that was pretty interesting. So anyway, let's look at the third. Let's look at all 3 of these together. This is pre and post KCUCS upper cervical care. Here's our dates: 7/11/11, 8/8/11, and 10/4/11. And we have, if you see the first one right here, you can recognize that curve is not normal. This one's looking a little bit better, and of course that's looking really good. That would be a good film to show as a normal. There's a slight anterior weight bearing, but you can't complain about that too much. That's a pretty good one.